Hello everyone, Dr. Brianne Callanan here, naturopathic doctor and regional territory manager with Designs for Health. Today I wanted to share a brief presentation with you highlighting a new product which is the Pure PC. We're going to discuss dosages as well as some other areas that you can use this product in. We mostly think of PC for brain health or phosphatidylcholine for brain health, but there are so many other really well-researched areas that you can actually use this product, everything from hormones to cholesterol support, gallbladder health, stone formation, as well as estrogen dominance. And we're going to discuss those throughout this video as well. So this is the new product that just recently launched. It is a Pure PC product. It is micellized, and we're going to talk about how it differs a little bit from the other liposomal products that Designs for Health has. You may have also seen that Designs for Health launched a liposomal GABA and L-theanine, which is working incredibly well, calming my kids, as well as my patients. So I'm really liking that one too. Okay. Moving on. So what is phosphatidylcholine or PC? Phosphatidylcholine is the basic building block of the cell membrane, and this includes every cell of the body, including the mitochondria. It supports cells' membranes and helps to make neurotransmitters. It actually crosses the blood-brain barrier and helps to make specifically acetylcholine, so it's really great for memory and cognition. It is the protective coating or part of the protective coating of nerves and brain cells, and it helps to make the myelin sheath, so it can be used in conditions such as multiple sclerosis. It has actually been used in the food industry for many years to emulsify fats and make them more water soluble, and it essentially does the same in our bodies as well. And it plays an important role in fat and cholesterol metabolism, and we're going to go through some of the research that's on that as well. So PC or phosphatidylcholine, small amounts can be synthesized from methionine or serine, but because those amounts are so small, it's still considered to be an essential nutrient to obtain from our diet. Food sources, some people use lecithin granules, but those only actually supply 10 to 20% of the phosphatidylcholine. Other sources would be egg yolks is a really great source, meats, broccoli, Brussels sprouts, or milk. You can see that many of these, your meats and your egg yolks are going to be animal proteins. So you want to look out for PC deficiency or phosphatidylcholine deficiency in those who are vegan or vegetarian because they're not having those in their diet. There is an increased risk of phosphatidylcholine deficiency in those with genetic polymorphisms related to folate, or that should say choline metabolism. And there seems to be an increased risk in those with menopause or those going through menopause, increased risk of phosphatidylcholine deficiency as well. So what is phosphatidylcholine used for? So number one, you might have heard it being used for brain health because it's a large component of the cell membranes and it influences what goes in and out of the cells. Like we said, it's a protective coating of the nerves and brain cells, helps make the myelin sheath, so it can be used in MS. We talked about it crossing the blood-brain barrier, facilitating acetylcholine production, so really great for memory. And there was actually a double-blind randomized control test of healthy college students utilizing a low and high dose of PC, so they tested various dosages of it. And with regards to memory, there was the greatest increase in memory when taking the higher dose of PC 90 minutes after ingestion. So if you're using this for students or entrepreneurs or just someone wants to improve their brain health and focus, 90 minutes prior to their executive function performance is going to be the most ideal time. So PC helps to emulsify fats in the body. We said that it was used in the food industry to emulsify fats. So we're just going to go through some various other conditions to consider PC in. Yes, it's great for brain health, but these are some other areas that have great research on using this product as well. So number one, gallstones. We know that 80% of gallstones are cholesterol stones in the Western world. And there's been several in vitro studies that showed a beneficial effect of phosphatidylcholine on cholesterol solubility and crystallization. There was also studies that showed that it improved bile flow, so thus it may prevent cholesterol stone formation by influencing the flow of the bile and also the consistency. Phosphatidylcholine, especially in this micellized form, is great for fatty liver. It's an important nutrient for promoting liver health. It helps the liver do many of its jobs, including better nutrient assimilation, hormone balancing, and toxin elimination. We're going to talk more about how it acts on estrogen dominance in the next slide, but it may help protect the liver against damage caused by pollutants, viruses, medications, and poisoning. Phosphatidylcholine may be beneficial to support the treatments of various forms of hepatitis as well. High blood pressure. PC may lower plasma homocysteine levels, which, when elevated, can increase our risk of heart disease and artery disease. PC also increases cell sensitivity to insulin. So thinking in those with endocrine disorders, metabolic syndrome, insulin resistance. PC may also support normal blood pressure and can help protect the body against the damaging effects of stress. So really, really a great other way to think about utilizing this product. My dog. So if you're having complex cases where you're seeing multiple areas, such as blood pressure, insulin resistance, fatty liver, this would be a great product to consider. It also facilitates estrogen detox. It may help alleviate estrogen-related problems by facilitating the liver's conversion of estradiol, we all know it's a stronger form of estrogen, to the estriol, the more benign form of estrogen. So where I'm primarily using this product is with estrogen dominance, helping with estrogen dominant related conditions like PMS, uterine fibroids, fibrocystic breast, and endometriosis by how it acts on the liver. Phosphatidylcholine, really great for cholesterol support. There are studies that show it significantly reduces total cholesterol, LDL, triglyceride levels, while simultaneously increasing HDL, which is amazing. This study was really interesting, looking at phosphatidylcholine supplementation in ulcerative colitis. And this is something that completely makes sense because we know that 90% of the phospholipids in the GI tract actually contain phosphatidylcholine. So it is protective and it's supportive to gastrointestinal mucosal barrier, and it's shown to exert an anti-inflammatory effect on the colon cells. In patients with ulcerative colitis, the protective colonic mucosa, the PC supplementation was actually shown to increase that PC concentration, which can be lowered by 70% in those populations who are having ulcerative colitis. And this was actually regardless of the state of inflammation. So it's helping to protect the gastrointestinal lining and helping to reduce inflammation in those with ulcerative colitis. It has been shown to improve remission and reduce the need for corticosteroid treatments. All of the research that has been discussed in these different boxes will be linked at the end as well for you to go through and look at those individual studies. So we're seeing everything from estrogen detox to cholesterol to ulcerative colitis to memory. So there's various uses you can use it, which is, I love having one product that's going to target multiple areas. There is another study really awesome looking at gastric and duodenal ulcers. So phosphatidylcholine, this was a food-based study. Increasing foods that contain phosphatidylcholine has been shown to be protective against gastric and duodenal ulcer formation and promoting ulcer healing. This is likely because, like we saw in ulcerative colitis, that mucosal lining contains a significant portion of phosphatidylcholine. Last one I want to cover is exercise and recovery. So we know that intense exercise for an extended duration can lead to depletion of circulatory choline. So choline from PC is involved with the formation of acetylcholine, the neurotransmitter that is necessary for those peripheral muscle contractions. So acute supplementation of phosphatidylcholine prior to exercise, I would be interested to see if, like the college students we talked about, if the prior to exercise, if that 90-minute window would be the most optimal, but they didn't talk about that in the study. But I would probably dose it 60 to 90 minutes before exercise. That has been shown to improve some aspects of athletic performance and markers of recovery, such as decreased lactic acid concentrations and faster return to normal heart rate. It'll also improve the memory and cognition. So for high-level athletes, this would be something to consider as well. So what can deplete phosphatidylcholine? Oral contraceptives, estrogen therapy, sulfa drugs, coffee, alcohol, and processed foods all are known to deplete lecithin, and phosphatidylcholine is a component of lecithin. So these are all things, you know, if your patients are on these types of therapies, or they're eating coffee, drinking alcohol, eating processed food, it may be necessary to up their dose of phosphatidylcholine. Phosphatidylcholine is also really important during pregnancy. As a side note, I didn't really include that, but it probably should have touched on that on the other sides. Most of the research that I was looking at showed therapeutic dosages of 1,000 to 3,000 milligrams per day. That's a typo, I'm gonna add that. 1,000 to 3,000 milligrams per day. And Designs for Health has a pure PC product that is recently launched, and there are some key components that make this pure PC, which is micellized, a little bit different than liposomal, but it makes it different in some positive ways. So what makes it different? So each 5 mils of the micellized pure PC delivers 700 milligrams of phosphatidylcholine. A serving is 1 teaspoon. If you're looking to get that therapeutic dosages of the 1,000 to 3,000 micrograms, you might want to consider doing multiple teaspoons a day. Typically how I've been using it is 1 teaspoon twice a day, and that is a recommendation that's on the bottle as well. We see that there's a dramatically enhanced absorption of phosphatidylcholine when it's in this micellized liposomal formulation. So it's not the double lipid bilayer, it's a single phospholipid layer because it's better absorbed that way. And it's extremely small droplets that are easily absorbed in the bloodstream, and they're actually absorbed through the submucosal. So what's going to be really important is that when a patient is using this product, they're holding it in their mouth for 30 to 60 seconds before swallowing. So dosing, again, we said 1 teaspoon by mouth twice daily. Again, a lot of the research, just keep in mind, was 1,000 to 3,000 milligrams per day. They were not always saying if that was a micellized, rapidly absorbing phosphatidylcholine or what form they were using. So it's hard to know. I would assume that because the pure PC is the smaller droplet size, so easy and readily absorbed, that 1 teaspoon twice daily, because the absorption is so much better, that you will be hitting those therapeutic dosages that were used in the research. And again, holding your mouth for 30 to 60 seconds before swallowing for maximal absorption. And here are the references. So if you're interested in seeing these, it looks like they all got grouped together, but I'm happy to send you the breakdown of the references. Or if you want a specific study on one of the specific conditions mentioned, I am happy to provide that as well. So I hope this was helpful for you, giving a little bit of insight in some of the other amazing ways that you can use pure PC in your practice and helping your more complex patients or patients that have multiple issues going on at once. This product really is amazing because it can target so many different things at one time. So I hope that was helpful. If you have any questions, please email me. That is my dog destroying something, so I'm gonna let you go. I hope you have an amazing night, and we'll talk soon.